All right, today we're tackling a really big topic, osteoarthritis. It's something millions of people deal with every day, but it's often kind of misunderstood. So we're going to break it all down, what it is, what's actually going on inside your joints, and maybe most importantly, what you can do about it. Let's dive right in. You know that feeling? You go to stand up and your knees just make a little noise, a little creak, a little pop. Or what about that feeling first thing in the morning where you're just a bit stiff and it takes a minute to get moving? Yeah? If that sounds familiar, you are definitely not alone. It's an incredibly common thing. Well, it turns out those little creaks and that morning stiffness, they're often the first signs of the single most common type of arthritis in the world. And that's exactly what we're here to talk about. Okay, so first things first, let's get a really clear definition. What are we actually talking about when we say osteoarthritis, or OA for short? So the easiest way to think about osteoarthritis is as a wear and tear issue. It's all about the cartilage, that smooth, slippery stuff that caps the ends of your bones and lets your joints move freely. Well, in OA, that protective cushion starts to break down over time. And a really key point here, it's what's called a non-inflammatory disorder. We'll get into why that's so important in a little bit. Okay, so to really get it, let's zoom in and take a look at what's physically happening inside a joint when OA sets in. This is where you can really see the mechanics of it. So picture the cartilage in a healthy joint like a brand new, high-tech shock absorber on a car. It's thick, it's smooth, and gives you a perfectly cushioned ride, letting your bones glide without any friction. But with osteoarthritis, it's like that shock absorber has driven a million miles. It starts to get worn down, it gets thin, and it just can't cushion the way it used to. And this whole thing doesn't happen overnight. It's a process. First, that cartilage starts to break down. As it wears away, the gap between the bones, the joint space, actually gets smaller. Now, your body, being smart, tries to fix the problem, but it's not a perfect mechanic. It ends up creating these little bony outgrowths called osteophytes. You might have heard of them as bone spurs. And it's this whole chain of events that leads to the pain and stiffness people feel. All right, so we've seen what's happening on the inside. But how does that feel on the outside? Let's talk about the signs, the symptoms, and what makes someone more likely to develop OA. It's actually really helpful to split this into two buckets, symptoms and signs. Symptoms are what you feel. Things like joint pain that seems to flare up when you're active, or that classic morning stiffness that, and this is key, usually goes away in less than half an hour. Signs, on the other hand, are what a doctor can find, like if the joint is tender to the touch, or if they can hear or feel that grating, crackling sound called crepitus when you move. So who's most likely to get this? Well, age is the #1 risk factor, no question. But there's a bunch of other things that play a big role. For example, it's more common in women. Obesity is a huge one because extra weight puts so much more stress on your joints, especially your knees. If you've had a big joint injury in the past, that can definitely set you up for it later. And yeah, genetics can play a part, and even your job if it involves a lot of repetitive stress on certain joints. Okay, so you've got some of the signs, you're feeling some of the symptoms. How does a doctor put it all together and make an official diagnosis? Let's walk through that. And sometimes the biggest clues are literally right there at your fingertips, especially when OA shows up in the hands. This is actually pretty interesting. There are these two super specific signs that doctors look for in hand OA. You've got what are called Heberden's nodes. Those are little bony bumps that form on the joint closest to your fingertip. Then you have Bouchard's nodes, which pop up on the middle knuckle. When a doctor sees these hard little bumps, which often don't even hurt, it's a huge clue that they're looking at osteoarthritis. So the whole diagnostic puzzle comes together like this. You've got the physical exam, where they're looking for things like those nodes. Then you've got imaging, and X-ray is the gold standard here. It can literally show that narrow joint space and those little bone spurs we mentioned. And they'll probably do blood tests. But here's the thing. They're not looking for OA. They're using the tests to rule out other things, especially rheumatoid arthritis. Okay, so getting diagnosed with OA isn't the end of the road. Not at all. The entire focus shifts to management. And we're not talking about one single magic bullet cure. Think of it more like a toolkit full of different strategies to help you manage symptoms and, most importantly, keep your quality of life high. So let's open up that toolkit. Part 1 is probably the most powerful, lifestyle and physical therapy. Things like weight management are absolutely crucial. Even losing a few pounds can take a massive load off your joints. Low-impact exercise is your best friend. Think swimming, cycling, things that build up the muscles around the joint to support it without all the jarring impact. And of course, working with a physical therapist or even using something simple like a cane can be a total game changer. Now, if lifestyle stuff isn't cutting it on its own, the next part of the toolkit involves medical treatments. And the main goal here is managing pain. This can be anything from over-the-counter pain relievers or anti-inflammatories, you know them as NSAIDs, to even creams and gels you can put right on the sore spot. And for a more direct hit, doctors can even do injections right into the joint for some serious targeted relief. And finally, for really advanced cases where nothing else seems to be working anymore, there are surgical options. The big one, of course, is total joint replacement, especially for knees and hips. It's a major step, for sure, but it can be absolutely life-changing in terms of getting rid of pain and getting you moving again. Okay, I'm sure as we've been going through this, another name might have popped into your head: rheumatoid arthritis, right? It's super common to get them confused, so let's take a minute and clear that up right now. This really breaks it down nicely. The biggest difference is the cause. Remember how we said osteoarthritis is mechanical wear and tear? Well, rheumatoid arthritis, or RA, is an autoimmune disease. That means your own body is mistakenly attacking your joints. And that fundamental difference changes everything. Look at the morning stiffness. With RA, it can last for over an hour, way longer than with OA. Another big clue? RA is often symmetrical, so it'll affect both knees or both wrists at the same time, whereas OA can just be in one. So after everything we've talked about, what's the one thing you should really walk away with? It's this. The most powerful tools for dealing with osteoarthritis aren't necessarily in a bottle. They're in your everyday habits. Things like staying active and maintaining a healthy weight, they aren't just nice ideas. They are, without a doubt, the single best things you can do to prevent and manage this condition. It's not just about passively accepting wear and tear. It's about actively taking care of the machinery that lets you live your life. So the real question is, what are you going to do to invest in your joint health today?